although we are an affiliate of the American Medical Association, I'd like to identify those characteristics of our practice of medicine here in Hawaii that I hopefully will give some insight into our issues here in Hawaii. In addition to our unique geography, we have a very rapidly growing elderly population. And in fact, Dr. Pat Blanchett, who's an expert in geriatrics, is here. She can tell you more about the staggering figures that we are faced with as our population ages very rapidly against national norms. With that is associated multiple chronic disabilities that add to the burden of care that we have in Hawaii. That accentuates our clinical issues far more, we believe, than many other parts of the United States. We also have a small population, so as much as there are large medical centers on the mainland that lend themselves to regionalization of medical services, we do not have that ability. Therefore, there are some unusual or exotic services that are only available on the mainland and make access to care geographically quite a challenge. We have for the physician who is in practice, and we have an unusually high number of private practitioners in Hawaii versus other parts of the United States. The high cost of living and doing business in Hawaii affects them as much as any other small business enterprise in Hawaii. We also have a uniqueness of disease trends that reflect the diversity of our ethnicity, as well as we have all the disease challenges of a very vulnerable population of Hawaii citizens, that is the Native Hawaiians. Now, all of these represent to us the challenges clinically that physicians face in providing care. I want to identify a few issues that have come forth from our membership in the past several weeks during this debate. But one is that if we are to model a government plan, it needs to do something, it needs to be far more efficient and effective than what we have in the state of Hawaii's Medicaid program. Our Medicaid program, if it is used as a model of a public plan, is ineffective, if not a disaster. The pool of participating physicians is small. Patient services and drugs are impeded by a lot of paperwork. The bureaucratic barriers drain resources from direct patient care. The second thing is that we have an acute shortage of specialists in the neighbor islands, much because of the factors I mentioned earlier. And that is coupled with a severe problem in primary care services. So to the extent that your legislation or our legislation in this country supports good primary care and primary care network, I think will do well for setting up the infrastructure that we need for good specialty care. Another issue is that our state legislature, because of its political influence from plaintiff attorneys, really resists effective or meaningful medical liability reform. And as much as I know that that is not the panacea for physician shortages in rural Hawaii, as well as reducing the cost of medicine or health care in Hawaii, I heard President Obama at the annual American Medical Association convention in Chicago identify meaningful medical liability reform as one of the important steps that he would like to take to assure that physicians are more concerned about patient care rather than worrying about their practice of defensive medicine. And finally, I'd like to say that we do have huge disparities in reimbursement, not only for providers like hospitals, but it affects physicians. And if you want further documentation on that, I'd be glad to furnish it.
That would be helpful. Thank you.
Thank you very much for this opportunity to express myself on behalf of many physicians here in Hawaii.